This morning on Health Watch, the alarming rise in prescription drug abuse among baby boomers. The current issue of Time magazine describes a national epidemic of pill popping so bad it's being called Pharmageddon. The numbers tell a disturbing story. Over the last 2 decades, deaths from accidental drug overdoses have increased fivefold, and now for the first time, unintentional overdoses have replaced car accidents as the leading cause of accidental deaths in 15 states and the District of Columbia. Dr. Barbara Krantz calls the epidemic the perfect storm. She's the medical director of the Hanley Center, an addiction treatment facility. And joining us from Miami, Ron Dash, a recovering prescription drug addict and former patient at Hanley. Ron, Dr. Krantz, it's great to have both of you with us this morning.
Good morning, Rebecca.
Ron, we'll come to you.
Good morning, Rebecca.
Good morning, and we'll come to you, Ron, in just a minute, but I want to start out with Dr. Krantz to tell us about this problem, because you say it's a pandemic. How did we get to these pandemic proportions?
Well, I think it definitely is a pandemic in the United States today, and we got there essentially in the late 1990s. There was a paradigm shift for treating chronic pain, and at the same time there was direct consumer advertising. So it made the perfect storm. People now were going to their physicians and they have arthritis, the weekend warriors, the baby boomers, and they're saying, I have this pain, and doctors are overprescribing.
And they need a quick fix for it.
Exactly.
So who is the most at risk for falling prey?
Well, what's interesting with that, Rebecca, is that the most at risk are not the street junkies, the typical stereotype that you would think of, but the people that are working, that are educated, that have had professions, you know, that are now looking for that better living through better chemistry.
And Ron, you sort of fall into that category of individuals. You're a baby boomer. You've been through this. Walk us through your story. How did you get to where you are today? And what was it that took you to the depths of prescription abuse early on in your life?
For me, first, good morning, and it's great to be here with you guys. For me, it started at a very young age. At the age of 10, I had some anxiety problems, and I was given a prescription for phenobarbital. I believe that set me off in a direction of not dealing with the things that bothered me and going to doctors and asking for a quick fix, you know, something to help me to feel better. Over the course of my youth, growing up in the 60s, the culture was encouraging towards social drug use. As I got into my professional career as a professional businessman, I went to doctors and I got prescriptions for stress, and it just mushroomed and progressed from there. At the age of my first surgery, I was given a prescription medication for pain, Vicodin, and as I grew older, I just became, you know, slowly more and more dependent on taking medications to help me cope, get up for work, and get through my day.
Dr. Krantz, I want to come to you on what people can do to avert this crisis, and also, if they see it in someone that they love, what the signs are. So let's start out with the activities abandoned or reduced. You say that's a specific sign to watch for in your loved ones.
Yes, exactly. There's a progressive isolation that occurs in their life where where they get to is that the drug is the only thing that's important to them, obtaining the drug.
So dependence on the drug is another sign.
Right, dependence, tolerance, withdrawal is another sign.
Also, duration or amount greater than intended, intrapersonal consequences, that they can't cut down or control it, and lastly, you say that it's become time-consuming. These are the big signs to watch for.
Absolutely. What happens is that the person finds themselves needing to take more of the prescription drug than intended or prescribed, and then they're taking friends or they're asking friends for their drugs. We saw a serious increase in the baby boomer drug addict. About 70% of our patients at Hanley are baby boomers. We have a special program for them now.
Well, we're happy you're drawing attention to it here, and thank you for what you're doing, Dr. Krantz. And Ron, thank you so much for being with us, and we're happy to see you in your recovery.
Thank you very much for having me.
Have a nice weekend to both of you.